Mark Bernard, who's going to present our program today.
Okay. This is truly an honor to, after you see what he does and what his group does, you'll be impressed, I'm sure. Mark is the current Director of International Service for District 7690. He's also the former Director of International Service and Disaster Relief in District 5280, which I think is in California. He's a member of the Global Grants Committee for our District 7690. He's a current Area 9 Foundation advocate. He's president and co-director of Operation Footprint Baja Project for Crippled Children. He's the past executive director of American Board of Pediatric Medicine. And he's an author and lecturer on topics in reconstructive foot and ankle surgery. He's been a Rotarian for 32 years. And what he does, his group does, is just amazing. And I'm so happy to have you here today, Mark.
Well, thank you. So can you all hear me?
Yes.
Okay, so let me first say thanks for the invite. And it's always great to speak to Rotarians because I speak Rotarian. So not only do I do the medicine side of it, but I do the Rotary side, and so I'm always talking to my own, so to speak. And it's fun. It's fun to talk the talk and walk the walk too. So let me shift to this, and please let me know when you can see my screen. Say when.
Okay, Mark, we are seeing your screen. It's a black screen now, and we're not seeing your PowerPoint yet.
Tell me when it comes up.
I have it.
Okay.
I have.
Got it?
I've got it.
You're good to
All
go?
right. So assuming we're good to go, the focal point of what I'm going to be speaking about today, with respect to the grant that I'm hoping that you may have an interest in participating in, relates to our activity in India, and I'll talk about that. But I also want to talk about my 40 plus years of experience in this, and 32 years of it have been as a Rotarian. In terms of our ability to get to these kids and help them out. A little bit about me. I took a sort of an atypical path to get to Rotary because I didn't know anything about Rotary except that when my doctor's group, this is when I was a resident and in training, we had a clinic in Mexico, just over the border in the city of Mexicali. And we were seeing a ton of polio, cerebral palsy, congenital clubfoot, and a whole variety of different things. And I truly, to be honest, I don't know if, I can't speak for anybody else, but it was the first and I think only true epiphany that I had in my life when I walked into that clinic and saw this ocean of pathology. And I said, I think this is what I'm going to be doing for the rest of my life. And I acquired the expertise to do it. And it's interesting and I can tell, there's more than a few people on this call that have some gray hair. And you'll know what I'm saying. When you go through the arc of life, in the beginning, it was, I really want to get good about doing these surgeries. And then it was, I really want to spread the word and teach other docs how to do it. And now, my perspective on this, to be honest, is when you're treating these patients, you're treating whole families. Because a lot of these kids, some of them can't walk at all because of the level of deformity, and then others are very late walkers because of the deformity, as you'll see. And these parents have to carry them around, and then as a result of that, they have to do, if they have other kids, they neglect the other kids, and so forth. So when you can intervene and make these kids ambulatory so that they're independent walkers by correcting these deformities, you're actually treating not just the kid and changing their lives, but you're changing the whole family's life. And it's that 50,000 foot view that you start to get as you spend more and more time with this. So moving on, the particular objectives of the grants are as follows. We we work out of a hospital in India that is being donated by a couple that own the hospital. They're truly humanitarian. They're not Rotarians at the moment, but we're trying to nudge them in that direction for obvious reasons. And the hospital is fine, but what we cannot now do because of the size of the operating rooms and the number of the operating rooms is we can't operate on more than 1 foot at a time. If a kid's got 2 feet, we've got to just do the 1 foot. And so we really need to fix that. And that's one of the things that the grant's going to do. And if we can expand the functional capacity by adding yet another operating room and enhancing the equipment that are in the operating rooms that do exist, we'll be able to double team the cases so that we can do at least twice the number of kids and more than twice the number of feet. And so that's the nuts and bolts of what this grant is about in India. And then part of what we've done at Operation Footprint and the Baja Project for Crippled Children, and what I've been involved in for over 40 years, is our job is not just to do the surgeries. Yeah, we do that and we lend our expertise, and it's, I don't think there's anything we'd rather do, but the idea is to train the local docs in what we're doing. And I want to, this is interesting. You would think that the orthopedic surgeons that are there would know how to do this stuff, because let's face it, what they literally are looking at outside their windows and outside of their offices is the same. There's so much pathology there. But you'd be surprised what the orthopedic surgeons in Agra do, and I imagine all over India, are the same bread and butter surgeries that the orthopedists do here. They do knees, they do hips, they do the occasional trauma, etc. They're doing the same stuff that we do here. So it doesn't matter that they're looking at this stuff out their window. It's just India, the healthcare delivery system there, as in a lot of emerging nations, is it's on a cash basis. So if you're dealing with with a lot of poverty there, these patients never actually get into these doctors' offices. So our goal there is twofold, also with the grant, which is to train the docs there in the way we approach these cases, and hopefully motivate them to want to at least do some of the work pro bono, and spread the word out to the community that this is a free service. And the challenge for the local Rotary Club there is to actually convince the people that what we're doing is free. And I can tell you that word has gotten around already. So we're not going to be short of patience, that's for sure. What we want to do is have the capacity to see a lot more the next time we get there. So let me tell you a little bit more about us. We've been around over 40 years. We started out in Mexico in 1976. That was the year I was a resident at County USC Medical Center, and we continued in Mexico. And then we had a connection in El Salvador, so we added El Salvador in about 20 years later. And then we, from there, developed. As the world found out what my group did, they started coming to us, and so we added Honduras in 2002. And then one of our directors, Dr. Bhavesh Shah, who is Indian by birth, but when he was 11, his family brought his family was brought the kids over and settled in Chicago. And so he was raised in Chicago, and then he became a podiatrist. He's been part of Operation Footprint's senior faculty for 20 years now, and his dream was to recreate what we've already been doing in these other areas in India. And that's what he did. So he brought our group there about a year ago, about 14 months ago, or part of our group, as you'll see, and said, take a look. Do you think this is something that we can add to our umbrella, meaning Operation Footprint? And we looked at it, we did the work, we said, yeah, this is a keeper if we can make sure that there's enough infrastructure on the India side to take care of these patients once we leave, because we do our surgeries in about a week's time frame. We screen the patients, decide which ones we're going to be doing, put them on a schedule, do the cases. And then when we're gone, if you don't have the aftercare available in these countries, you're better off not doing the surgery. And once we were convinced that we had that in place, it set up perfectly for writing a grant to expand the functional capacity, as I'm talking about. All right. Over the 40 years that we've been in existence, we've done about 3,000 major foot and ankle reconstructions. A lot of it is club foot. A lot of it, must tell you, it's important to us as Rotarians. A lot of it was polio reconstructive surgery. So the first 20 years of this project's existence, we did lots of polio corrections. And then I'm happy to tell you that I haven't seen a case of polio in deformities in Central America and Mexico in over 20 years. But 3 of the kids that we saw 14 months ago in India, in Agra, had deformities related to polio. So while from a vaccination perspective, we've wiped it out, there's still the lingering deformity that needs to be taken care of. So if you are interested in supporting this particular grant, not only are you supporting this project, but you're actually doing polio plus work indirectly as well. And then we've seen over, if we counted up all the cases we've done, or patients we've seen, I should say, we've seen over 30,000 patients over 40 years. So we do a lot. And we've trained over 200 residents over all that time. And that's not counting all the orthopedic surgeons that we've trained that stay in the country to do the aftercare and hopefully to do the humanitarian work when we're not there. So this is what we're talking about. Now, in the US, if I would get a child, if I would be called in to the hospital, or if the child was sent to me by the time they're 2 weeks old, the foot may look like this, but it's extremely flexible. You start manipulating it, you put them in casts, and in about 7 cast changes, I can take a foot that's in that attitude and bring it into complete correction. The most you need to do is you take a blade and go under the skin where the Achilles tendon is, and you pop it. Honestly, it's not more complicated than a child getting her ears pierced. Gotta know what you're doing, of course, but that's how simple the surgery becomes. If you wait as much as 6 months, let alone a year, it becomes rigid, and you can no longer do it by just manipulation and serial casting. Then you got to go in, and then it becomes a major surgery. Then when these kids, and as I said, this is not, unless the child has other spinal problems, if it's just a birth defect of the foot, they will walk. And but whereas a normal child will walk at the age of say 11, 12, 13 months of age, these kids, because the feet are turned under, they don't get a chance to be toddlers. So by the time they're coordinated enough to walk, they can be 2 years old. And it's nice that they're able to walk. The problem is once they start bearing weight on this, they deform it even more. And then the bones get set. These are growing bones. And so they're adapting to the pressure of the foot being in this attitude. And then they set in that direction. And then the bones themselves change shape. If you look at the foot in the lower right, these cases can be so severe that when we go in surgically, it may be too much of a danger to the patient to take a foot that's in that position and make it perpendicular. So we sometimes have to do this in 2 stages. And if we're in a country only 1 week in a year, then they have to wait 2 years for this foot and then 2 years for the next foot if they have it on both sides. So it's a 4-year process for them. And they're more than happy to do it because we are often the only show in town, so to speak. So here's an example of a kid. She's 15 years old. This is just it's dramatic for you to look at if you're not used to seeing it, but this is what we see. So neglected club feet. She can actually wear normal shoes, except that when she puts them on, the foot is so deformed that the foot is upside down and backwards, basically, and that's the way she walks. And when a kid like this gets surgery, and as I say, this would be one that it's two surgeries on each foot, you're changing her life. You're changing her life. There's both the social stigma of deformity that makes these kids a social outcasts, and not so much in Central America, but I can tell you, even 20 years ago, the myth of these being people that are subject to the evil eye and other things that have nothing to do with reality, they're really stigmatized, and so you're really changing their lives. Marriageability becomes an issue, and so forth and so on. This is polio, and this is an example. Polio can manifest itself in many different ways, and this person was relatively lucky in that it only affected his feet. But as you know, polio can affect the knees, the hips, upper extremities, and can be quite deforming. When they're that bad, then they are out of our bell curve of procedures that we do. But to take a foot that you see on the left is in one surgery, we can get it to the way you see it on that same patient, post-operatively on the right, several months down the line. So it's dramatic. Videos will not show on regular Zoom, but there is a hyperlink that some of you, if you haven't already viewed it, can be sent to, has been sent, I guess, to you, and you can see the videos of kids that walk and what they look like when one particular child, and what she looked like before and what she looked like afterward. And it's just one of hundreds and hundreds that we have done. So this is part of that happens to be the little girl with nice straight feet. If you look down, basically the before looks like the images that I showed you, and the video will show you the way she walked, and the after is what you see right there. The guy that did the surgery was the guy with the Superman t-shirt, and that's Bhavesh Shah. And it was his dream. He's part of our team, as I told you, and his dream was to have us add India to what we do. Interestingly enough, I'm the oldest one in that group, and I'm the only one who's got hair. Crazy. As they say, it takes a village to help a kid or to raise a child, and it takes a lot of people to make this happen. And as you see there, that's the recovery room. Oh, by the way, part of the grant will be to expand the space and add beds and so forth for the recovery area as well, because as we finish these cases, we need expanded space to put them. So what you see, who you see standing there is a combination of the Indian staff at the hospital, Indian Rotarians. I'm the third from the right, and several of our group. And if you see the two people, there's a tall guy and a woman next to him dressed in surgical blues. Those are the on-kits, and they are the people that have donated the use of their hospital. And understand as well that once they're outfitted this way, not only will our group benefit, but any humanitarian group that wants to get in there that the on-kits are willing to bring in will have that same advantage due to the augmented capacity at the hospital. So I want to spend some time. We as Rotarians know what volunteerism is, and it's just what we do. But I want to show you what this looks like in monetary terms relative to the kind of surgery that I'm talking about that we do. The surgeries that we do include, when all the volunteers doing this includes the surgeons and their work, the use of the hospital facility, all of this is donated, the anesthesiologist donated, all of the surgical supplies, which includes the hardware, meaning the pins, screws, nails, suture, everything related to the surgery, including the casting materials, all the post-operative supplies, meaning the crutches, casts, etc., orthotics sometimes after the fact, foot and ankle orthotics. As you see here, braces and orthotics. Any physical therapy, if they are fortunate enough to be able to, a lot of these people live somewhat remote, but if we can get them to volunteer physical therapists, a lot of these cases need physical therapy because they're in casts for several months and they become very, very weak, as anybody would. If any of you have been in a cast, you know just how weak your muscles get because of the immobilization. So same story. Now kids bounce back a lot quicker than adults do, but you still need physical therapy along the way. Now, over the 40 years we've been doing this, if we amortize what all of this is and what it actually costs us to do a session, it works out to about $750 a case. 40 years ago, it was about $500 a case. So one case, when everybody says yes, that's what you're talking about. What that case would cost if I did a kids clubfoot in the US, in a major metropolitan area like LA, where I would do these, it would be an overnight stay. You get a healthy kid, you go in, it's an overnight stay in the hospital, make sure the kid doesn't have any anesthesia complications and so forth. You're talking about $50,000. $30,000 is probably an archaic number. So it's the difference between $50,000 and $750 when everybody says yes. So as far as the funding for this particular grant, which if you wanted to go in, those of you that have authorization, it's partially filled out, but that's the global grant number, is if you amortize $750 per case, we think we can easily do 25 cases. That would be more than 25 feet, but 25 cases, you got that number. We've got to add more surgical lights so that we can do 2 feet at a time. We have to add another operating room and put an anesthesia machine and lights into that room as well. And then we've got to add more instruments so that we can do 2 feet at a time in that third room. So at minimum, what we're looking at here is a grant request that I'm going to be requesting to RI for $56,000, $57,000. And by far, I can tell you that because I've been a Rotarian for so long and I've written grants, by far our strongest support of Operation Footprint's strongest financial support has been through Rotary, through global grants. I've probably written 9 over the years for this project. And then, of course, I've written other grants. I'm not a one-trick pony. I've written other grants for other things that my former district was doing and so forth. But as far as this project, and then we do get the occasional individual donations. You can donate individually as Rotarians. And if you do that, by the way, once the grant is approved, then you get credit by way of Paul Harris recognition points, just as though you were donating to share and other aspects of the foundation. So that's a nice thing that RI has actually done. And then honestly, we couldn't get by if we didn't also get donations in kind from the medical industry. In other words, whatever we cannot get donated in terms of supplies and equipment, we of course need to buy. So donations in kind are as good as money to us. None of what we do, by the way, if any of you, I don't think I mentioned this, but we pay our own way. We've been doing this for 40 years. All of our costs we bear as individual doctors going to these countries. We have zero, literally, that means that Operation Footprint operates at 0% overhead. Where 100% of the monies that come in go to the supplies and the equipment and so forth. We pay our own way. Thanks to Rotary, the Rotarians in the host countries have been very generous, and they will bring us lunch at the hospitals. They will, if we want to, they will put us up in their homes. But at minimum, what they do is they will have events in the evening where they will do a barbecue or they will do a group meal, and it's just great fellowship. So that's why I say I talk the talk as a Rotarian and I walk the walk as a doctor, and so I'm very proud of both sides of it. We hooray for us as Rotarians. That's all I can say. Related to date, I've got, let me get into the nitty gritty for a minute. I'm almost done with this. We can get into Q&A. Our district, our Global Grants Committee is willing to donate up to $10,000 towards this grant on a matching basis. What that means is we really want to stimulate clubs in our district to write checks for global grants. I can tell you the culture is just different in 7690, as I've learned, compared to my former district, where when I was director of international service and I was giving out awards, I had to wade through 40 global grants to give out the awards. In our district here, if we have a half a dozen grants at any given time, that's a lot. So we as a district at the leadership level and at the Global Grants Committee level really want clubs to start supporting grants, let alone writing them. And so I can get up to $10,000, but it's at the moment it's dependent upon raising $10,000 from among the clubs in our district that are interested. So not that I wouldn't be proud to be lecturing about this anyway, but I don't need a carrot, but that's the technical carrot. These are the clubs that have at least interest and or within our district and or have confirmed support at some level or another, and hopefully this will translate to you. If you are interested, by all means, contact me. I will give you all the information you need. And if you want to take a little bit deeper dive into what this looks like with us being in India, please view, it's about an 19 minute video. And you can view the video and that'll give you hopefully some additional insights. So that being the case, let me now go back and hand this over. Let me close this out and hand this back over. Where is?
I am right
There
here.
it is. There it is. Hold on. Well, where is I'm going to stop the share.
In the upper right corner of.
I know. Let me stop the share. Hang in there. But I'm looking for the picture of the water.
Oh, I switched it. I'm so sorry.
Oh, you switched up on me. Okay.
I did.
Hold on. Hold on.
So just in the upper right corner of my.
All right. Tell me if you got it now.
I got it now. Thank you so much, Mark.
Sounds good.
What an amazing project that and the fact that you guys have done this for so many years and are so well organized at what you do. But to see what you're able to do with these children who go from having a not so normal life to having a much more normal, fulfilling life, post surgery. It is amazing work. We have a few minutes. If there are questions, I will ask you guys to unmute yourself so you can ask questions if you need to. And while I'm giving some people a chance for that, Mark, I will tell you that our board of directors met earlier this month, and the Thomasville Rotary Club will be contributing $1,000 to this global grant project. I think there were a number of us who were able to see this project during the fall training seminars, and we were touched by it. So we had enough information in advance of even you presenting today that we knew it was something we wanted to support.
That's wonderful. Thank you so much. Thank you.
Okay. Does anybody have questions? I am not seeing any. Wow.
When I'm, it's funny when I met with, it's kind of funny when I met with silence. I remember one year I said to a friend as I was leaving, this is live, I was leaving the stage and I said to a friend, I whispered, was it something I said? And he said, no, it was everything you said. So I'm not insulted. It just means I gave you the information you needed. So thank you. And thanks for your ear very much.
And absolutely, that is true. Your presentation is very thorough. You can tell not only is this close to your heart, but you've presented enough that you answer the questions in advance that you know you're going to get at the end. So I'm seeing a lot of thumbs up, a lot of applause out there, Mark. So again, we appreciate it very much and look forward to seeing this global grant project succeed and seeing what you guys accomplish through this particular grant.
Yeah, years ago when I was first introduced, went to Pets, becoming president, and I forgot his name. I'm sorry, I did. I forgot his name. But when I first heard Operation Smile, I was kind of like that. I just couldn't say anything, and I think this ranks right up there with it. I mean, what an amazing thing to see. And I the word I wanted to hear a while ago was you say it's really transforming lives is what it's doing. So it's amazing, just like Operation Smile does. So
if I can, you reminded me when you said Operation Smile in Mexico. I don't know how many minutes we have, but it's I think it's worth sharing. In Mexicali, we worked out of the Red Cross Hospital, and we would share the hospital in the operating room with Operation Smile coming out of a group. It was a group of plastic surgeons coming out of San Diego, and we would always check our schedules so that we'd have the operating room 6 months out of the year, and we would just work out a schedule. And there was one time that I went down there. I said, would you folks mind if I went down there and watched what you did? And of course not. And so I went down and I watched them do their work. Now I take what I do for granted, right? Because I've been doing it all these years, and you can take a foot that's 2-3 inches long and that's upside down and backwards, and I can just fly through it. But you look at these cleft palates, and you watch the way they're drawing out their skin flaps and everything else, because they draw it out with methylene blue. It's an ink that you put on the skin, and you look at it. And I'm a trained surgeon. You look at it. How in the heck are they going to get that to close? And then you watch them do what they do, and everything fits in like a Chinese, like a puzzle, and you just shake your head. They, to me, they're wizards. And maybe they look at us the same way. It's just an amazing thing. I have the same wonder that you do, even though I can cut tissue like the next surgeon can. It's just amazing. Also, I wanted to say before we're done, if your club, this is on behalf of the Global Grants Committee, not about this grant. We are there to mentor you. So if you ever want to get to the point that you want to author a grant, and you feel that you need some advice as the best way to go and how to handle writing out, because you need some savvy as to what you tell RI. It's not that it's difficult, but it's just a matter of life savvy as to how you write these grants. So if any of you want to embark on that, or whether it's our grant or not, I mean, we're there to help you. Take advantage of us. All right, that's why we're there. So that's about it.
All right. And thank you again, Mark, and not just for today and this global grant, but for the position you've taken with our district to assist with that.
Bet.
Folks, I got one question.
Okay, go ahead, Don.
How is this situation handled in this country? Is there some way?
I'm having trouble hearing that.
Don, you're going to have to
I see.
repeat. Yeah.
How is this situation handled in this country? Is there some way that the county or something is notified when low-income families have a birth of this nature?
Yes, generally what happens here, the infrastructure exists as far as if they're indigent, CCS, Crippled Children's Services handles the funding of it. And they would either be sent to a children's hospital or a Shriners if it's a major surgical reconstruction. But in the vast majority of cases, we can get to these kids so early that if it's just a simple clubfoot, to me, simple clubfoot, where the child doesn't have cerebral palsy and doesn't have these other more complicated presentations. If it's just that, then that would be sent to me as a private practitioner or in a group, and I would start casting the kid and so forth. If I had to take the kid to surgery, then again, it generally goes to it's funded by Crippled Children, and a lot of the standard hospitals shy away from cases under a year old because of insurance. So it's not that they don't have all the instruments and the doctors that have the know-how, but it becomes an insurance issue. So they'll funnel them to some place like Duke or Chapel Hill because they're set up for it and they're insured for it. Did I answer your question?
Yes, I believe so. I was just wondering
Okay.
if there was a way to get to them within the first few weeks.
Yes, that's easy. That part's easy.
Okay. All right. So
All right. Thanks, everybody.
thank you again, Mark.